Hi Nick, I'm Zach. I'm going to be your student physical therapist today. We're going to be testing for two different things today, but the first thing we're going to look at is called the Thomas test. The Thomas test is used to look for Iliopsoas or Rectus femoris tightness. So it is a muscle length test for that quadricep area. So what I'm going to have you do is I'm going to have you lay down in a supine position with your legs dangling over. And you're going to go ahead and hug your knees at least 80 degrees. So that way we can look at the length of the quad muscles in this position on the opposite side. What I'm going to have you do is I'm going to have you both up here, because what I want to measure for is if you have any compensation with your ASIS. As soon as your ASIS starts to move forward, I'm going to stop it there and take the measurement of the angle from your hip. So what I'm going to be using is a goniometer to put the fulcrum at your hip joint, and then the stationary arm is going to bisect your hip, and then the moving arm is going to be in line of your femur heading toward your lateral epicondyle. Okay, so what I'm going to do is I'm going to have you start up here, placing my hand here, and then we're going to lower as low as you can without any type of compensation. And the fact that you're able to have your thigh on the table without having any compensation of your hip means that you're already within a 10 degrees of hyperextension of the hip. But if I wanted to measure, what I'd be looking at is from here, looking to see where the compensation would be. So that would be no compensation for the iliacus. And from here, your foot also dangles down, which means that there's no compensation or tightness in your rectus femoris as well. The next thing that we're going to do is we're going to be testing dorsiflexion with inversion of the ankle, specifically looking at the anterior tibialis, which is innervated by the deep peroneal nerves. So what I'm going to do is you're going to be in short sitting, and then I'm going to go ahead and stabilize you in the back of the foot, and I'm going to see if you can even do the range of motion. So what I'm going to have you do is you're going to go up and in. Okay, so can you go ahead and do that motion for me on your own, and then come back down? Any pain or sensations with that? So now what we're going to do is I'm going to put you into that position again to test the manual muscle test of that, or the strength integrity of this. So from there, I'm going to add gradual pressure. So hold, hold, hold. Good. So that would be considered a 5 out of 5. And then we just determined to see if you'd break earlier. That would be a 3, 4, or 5. If you could not do a 3, or you couldn't hold against resistance, what we do is we put you in a supine position. So go ahead and go up into that. And from here, you're going to keep your foot straight, and you're going to go into that position again. And all I'm going to see is if your calcaneus clears the table. Okay, so the thing about this movement is that some limitations could be tightness of the gastroc muscle, and then when you try to go into that, the gastroc would try and limit that, or weakness in the anterior tibialis muscle.